Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 12 practice NCLEX questions. Without delay, let's get started.
Which of the following findings would most likely indicate the presence of a respiratory infection in a client with asthma? 1. Cough productive of yellow sputum. 2. Bilateral expiratory wheezing. 3. Chest tightness. 4. Respiratory rate of 30 breaths per minute. The correct answer is 1. A cough productive of yellow sputum is the most likely indicator of a respiratory infection. The other signs and symptoms, wheezing, chest tightness, and increased respiratory rate, are all findings associated with an asthma attack and do not necessarily mean an infection is present. A child with hemophilia presents with a burning sensation in the knee and reluctance to move the body part. The nurse collaborates with the care team to provide factor replacement and 1. Administer an aspirin-containing compound. 2. Institute rest ice compression and elevation. 3. Begin physical therapy with active range of motion. 4. Initiate skin traction. The correct answer is 2. The child is displaying symptoms of bleeding in the joint and factor replacement is indicated. The Rice method is used additionally as a supportive measure to help control the bleeding. Aspirin-containing compounds contribute to bleeding and should never be used to control pain. Physical therapy is instituted after the acute bleeding to prevent further damage. Orthopedic traction is considered in some rare cases during the rehabilitation phase, but not the acute phase. The nurse should teach the client with asthma that which of the following is one of the most common precipitating factors of an acute asthma attack? 1. Occupational exposure to toxins. 2. Viral respiratory infections. 3. Exposure to cigarette smoke. 4. Exercising in cold temperatures. The correct answer is 2. The most common precipitator of asthma attacks is viral respiratory infection. Clients with asthma should avoid people who have the flu or a cold and should get yearly flu vaccinations. Environmental exposure to toxins or heavy particulate matter can trigger asthma attacks. However, far fewer asthmatics are exposed to such toxins than are exposed to viruses. Cigarette smoke can also trigger asthma attacks, but to a lesser extent than viral respiratory infections. Some asthmatic attacks are triggered by exercising in cold weather. Because of the risks associated with administration of factor VIII concentrate, the nurse should teach the child's family to recognize and report which of the following? 1. Yellowing of the skin. 2. Constipation. 3. Abdominal distension. 4. Puffiness around the eyes. The correct answer is 1. Because factor VIII concentrate is derived from large pools of human plasma, the risk of hepatitis is always present. Clinical manifestations of hepatitis include yellowing of the skin, mucous membranes, and sclera. Use of factor VIII concentrate is not associated with constipation, abdominal distension, or puffiness around the eyes. Which of the following health promotion activities should the nurse include in the discharge teaching plan for a client with asthma? 1. Incorporate physical exercise as tolerated into the daily routine. 2. Monitor peak flow numbers after meals and at bedtime. 3. Eliminate stressors in the work and home environment. 4. Use sedatives to ensure uninterrupted sleep at night. The correct answer is 1. Physical exercise is beneficial and should be incorporated as tolerated into the client's schedule. Peak flow numbers should be monitored daily, usually in the morning. Peak flow does not need to be monitored after each meal. Stressors in the client's life should be modified but cannot be totally eliminated, although adequate sleep is important. It is not recommended that sedatives be routinely taken to induce sleep. The mother tells the nurse she will be afraid to allow her child with hemophilia to participate in sports because of the danger of injury and bleeding. After explaining that physical fitness is important for children with hemophilia, which of the following activities should the nurse suggest as ideal? 1. Snow skiing. 2. Swimming. 3. Basketball. 4. Gymnastics. The correct answer is 2. Swimming is an ideal activity for a child with hemophilia because it is a non-contact sport. Many non-contact sports and physical activities that do not place excessive strain on joints are also appropriate. Such activities strengthen the muscles surrounding joints and help control bleeding in these areas. Non-contact sports also enhance general mental and physical well-being. Falls and subsequent injury to the child may occur with snow skiing. Basketball is a contact sport and therefore increases the child's risk for injury. Gymnastics is a very strenuous sport. Gymnasts frequently have muscle and joint injuries that result in bleeding episodes. Which of the following is an expected outcome for an adult client with well-controlled asthma? 1. Chest X-ray demonstrates minimal hyperinflation. 2. Temperature remains lower than 100 degrees Fahrenheit. 3. Arterial blood gas analysis demonstrates a decrease in PO2. 4. Breath sounds are clear. The correct answer is 4. Between attacks, breath sounds should be clear on auscultation with good airflow present throughout lung fields. Chest X-rays should be normal. The client should remain afebrile. Arterial blood gases should be normal. The healthcare provider has determined that a preterm labor client at 34 weeks gestation has no fetal fibronectin present. Based on this finding, the nurse would anticipate that within the next week, 1. The client will develop preeclampsia. 2. The fetus will develop mature lungs. 3. The client will not develop preterm labor. 4. The fetus will not develop gestational diabetes. The correct answer is 3. The absence of fetal fibronectin in a vaginal swab between 22 and 37 weeks gestation indicates there is less than 1% risk of developing preterm labor in the next week. Fetal fibronectin is an extracellular protein normally found in fetal membranes and deciduous and has no correlation with preeclampsia, fetal lung maturation, or gestational diabetes. A nurse is teaching a client to use a metered dose inhaler to administer bronchodilator medication. Indicate the correct order of the steps the client should take to use the MDI appropriately. 1. Shake the inhaler immediately before use. 2. Hold breath for 5 to 10 seconds and then exhale. 3. Activate the MDI on inhalation. 4. Breathe out through the mouth. The correct order is 1, 4, 3, and 2. When using inhalers, clients should first shake the inhaler to activate the MDI and then breathe out through the mouth. Next, the client should activate the MDI while inhaling, hold the breath for 5 to 10 seconds, and then exhale normally. A nurse is discussing preterm labor in a prenatal class. After class, a client and her partner ask the nurse to identify again the nursing strategies to prevent preterm labor. The clients need further instruction when they state which of the following? 1. I need to stay hydrated all the time. 2. I need to avoid any infections. 3. I should include frequent rest breaks if we travel. 4. Changing to filter cigarettes is helpful. The correct answer is 4. Smoking in any form is contraindicated in pregnancy, regardless of the type of filtering system used. Smoking is a major risk factor for preterm labor and decreased fetal weight. Dehydration is a risk factor for preterm labor, as is prolonged standing and remaining in one position. Infection is thought to be a primary cause of preterm labor, and the client would need to avoid contracting any type of infection. While taking trips, frequent emptying of the bladder prevents infection and ambulates the woman. A client who has been taking flunisolide nasal spray, 2 inhalations a day, for treatment of asthma has painful, white patches in the mouth. Which response by the nurse would be most appropriate? 1. This is an anticipated adverse effect of your medication. It should go away in a couple of weeks. 2. You're using your inhaler too much and it has irritated your mouth. 3. You have developed a fungal infection from your medication. It will need to be treated with an antifungal agent. 4. Be sure to brush your teeth and floss daily. Good oral hygiene will treat this problem. The correct answer is 3. Use of oral inhalant corticosteroids, such as flunisolide, can lead to the development of oral thrush, a fungal infection. Once developed, thrush must be treated by antifungal therapy. It will not resolve on its own. Fungal infections can develop even without overuse of the corticosteroid inhaler. Although good oral hygiene can help prevent development of a fungal infection, it cannot be used alone to treat the problem. A multigravida client at 34 weeks gestation is being treated with indomethacin to halt preterm labor. If the client gives birth to a preterm infant, the nurse should notify the nursery personnel about this therapy because of the possibility for which of the following: 1. Pulmonary hypertension. 2. Respiratory distress syndrome. 3. Hyperbilirubinemia. 4. Cardiomyopathy. The correct answer is 1. Indomethacin has been successfully used to halt preterm labor. However, if the client should give birth to a preterm infant, the nurse would notify the nursery personnel about the tocolytic therapy because this drug can lead to premature closure of the fetal ductus arteriosus, resulting in pulmonary hypertension. Prematurity is associated with RDS because of the immaturity of the fetal lungs. RDS is not a result of indomethacin. Hyperbilirubinemia is more common in preterm infants. Use of indomethacin to halt preterm labor is not associated with cardiomyopathy in the infant.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.